This number should be a wake-up call. 5,197 new coronavirus cases reported in our state today. It smashes all records since the pandemic began, not something any Coloradan should be proud of. Good evening and welcome to Denver 7 News at 10. I'm Ann Trujillo.
And I'm Gary Bro. Thanks for joining us. That huge number, it feels like a gut punch, especially with all these new restrictions we're seeing across the state. But public health doctors today said, give it time. Dozens of counties tightened up rules in the last week or so, limiting the capacity in restaurants, places of worship, and offices. The state health department is still hopeful that these mitigation efforts could shift the numbers in the next week.
And with the virus spreading quickly, our state is testing like never before. Nearly 45,000 Coloradans have been tested just in the last 24 hours.
But as I found out, not all tests are created equal, and some doctors are warning less accurate tests can give a false sense of security. 1.7 million rapid COVID-19 tests are making its way to Colorado courtesy of the federal government. But can those tests or any other quick test be trusted?
There's an enormous prevalence across Colorado of tests that are unreliable.
Dr. Richard Zane is the chair of emergency medicine at UCHealth, University of Colorado Hospital.
Currently, we have different types of testing available. All of them are PCR testing, not antigen testing currently.
UCHealth may not have those rapid tests, but the state acknowledges 5 types of COVID testing. The 2 most important ones, PCR tests, which are the benchmark because of its accuracy, but can take several days and sometimes longer to get the results. And then there's antigen tests, which are the rapid tests, not as accurate, and all negative tests should be confirmed with a PCR test. Antigen tests aren't as sensitive as the PCR versions, which can pick up a small amount of the virus. The lower the sensitivity, the more likely a false negative.
There's a very good chance of a false negative is higher than a true negative, meaning that it could give you very unreliable results, essentially telling you don't have COVID when you may have COVID, simply because of the characteristics of the test.
We have hundreds of thousands of instant tests available. These are less accurate, but they have a very important role in screening.
That was Governor Polis speaking to the public on Monday. In a statement tells Denver 7, while rapid antigen tests are most reliable when individuals are symptomatic, if they are used in environments where there is frequent testing, they can be effective even when individuals are asymptomatic. Dr. Zane is concerned many are getting these false negative results and continuing on with their lives status quo.
I've actually cared for people who have come to Colorado. They've gone to an urgent care to all get tested, either before they got on the plane or when they came to Colorado, thinking that that was the right thing to do. And it makes sense if you're a layperson that that's the right thing to do, but the tests are just unreliable.
And widespread testing is just one part of Colorado's plan to stay on top of this pandemic. Another piece of the puzzle is contact tracing, and right now our contact tracers can't keep up with the surge. Contact tracers track people with the virus, figure out who they've been in close contact with, and then ask them to quarantine. Well, the Denver Post reports the current surge is outpacing what Colorado's roughly 800 contact tracers can manage. Public health staff in Boulder, Jefferson, and several other counties sent a letter to state leaders sounding the alarm.